Hello, everyone. This is Brenda Bandy. I know it's straight up 12 o'clock, as I like to say in Manhattan, Kansas Central Time. So, welcome to the Kansas Breastfeeding Coalition emPOWER Talk. I am the executive director of the Kansas Breastfeeding Coalition, and we are so happy that you have chosen to spend the next hour with us to sharpen and hone your lactation skills. We have quite the A team here with us. That we hope is going to be able to share about some practical tools that we could all use in our daily practice with lactation. So please introduce yourself in the chat. We think it's also important that we build connections and networks here in Kansas amongst all of you. So please drop into the chat where you're from, your name, your community, and maybe what program or how you serve moms and babies. And then we can begin to see who's in the room and how we might be able to connect with each other as well. So welcome. Those of you who have been with the Kansas Breastfeeding Coalition for a while may remember that last year we started these emPOWER Talks as a way of taking a deep dive into a specific topic. And last year we really focused on policies that impacted lactation. This year we're pivoting to practical problem-solving skills for lactation. So this entire year we are gathering around specific topics. We are going to have these mighty three, I call them the A team when it comes to lactation. Next slide, and I'm happy to introduce our A team. We have with us Dr. Kathy Leeper. Many of you may recognize her from her time with us before. Welcome back, Kathy. We are so glad that you are with us.
Thank you.
Yes, and for those who don't know, Dr. Kathy Leeper, she is the co-founder and medical director of MilkWorks in Lincoln, Nebraska, and they recently opened in Omaha, Nebraska as well. And she is one of the first breastfeeding medicine specialists in the U.S. And so we are thrilled to have you with us in Kansas once again, even though it's just virtually. We also have with us Stephanie Henry. Many of you may recall her if you've ever done WIC trainings with us when we first started. She was a part of that. She is an international board certified lactation consultant who's been working with the Kansas WIC program in Southeast Kansas since 2009. She provides prenatal trimester breastfeeding education classes and lactation consults and telehealth lactation consults to families in her community, and she is a tremendous champion for breastfeeding. We also have another Stephanie. Stephanie Kaufman joins us from Hutchinson, where she is the lactation and discharge coordinator at Hutchinson Regional Medical Center and the founder of Shine Lactation and Postpartum Support, which is a private lactation practice. And she has over 29 years of experience with maternal and newborn care. She also is an instructor for the Kansas Breastfeeding Coalition. If you've taken a Breastfeeding 101 course, you probably have met Stephanie Kaufman as well. So we have Stephanie Henry, Stephanie Kaufman, and Dr. Kathy Leeper, who will be with us this entire year for our emPOWER Talks. So welcome, and we really appreciate you all being here. Let's get started with our first case. And just to kind of set the stage, everyone, Stephanie, and Kathy were invited to submit cases based on what they see and encounter in their practices. And this time our topic is on low milk supply. So they're going to discuss the case. We will have some polling questions, so don't walk away from your computer or your phone. You'll want to participate in the polls, and then we invite you to participate in the chat also. So I believe this first case was submitted by Stephanie Henry. Stephanie Henry, I'm going to turn it over to you to read the case for us and then start us off with the discussion.
Perfect. Thank you, Brenda. I'm so excited for this. I told Brenda earlier, just pretend that you're in my living room on the farm, grab a cup of coffee, and we're going to have a discussion. So this case actually took place last week. I work in WIC world, and we get a lot of phone calls from moms with questions about milk supply. So this mama had a 6-month-old. She called the office. She had questions about a drop in her milk supply. So she works part-time, anywhere from 4 to 5 hours a day, basically from 11 to 2 or 11 to 3. She pumps one time while she's at work. She nurses that baby, remember, 6-month-old. So she nurses the baby first thing in the morning, then pumps before she goes to work, leaves a bottle for grandma, who is the caregiver. So that normal pumping is with a wearable breast pump. She consistently gets 4 to 5 ounces every time that she pumps. But the past 3 days, she noticed that that supply was basically cut in half. So where she was pumping that 4 to 5, she's only getting 1.5 to 2 ounces combined total. So she called because she was worried about losing her milk supply. So, my besties, Kathy and Stephanie, we're going to talk about what we would first ask that mama when she calls us. And for me, it's always that heart connection. I know that you know that with me, because I feel for those moms. I think that that's a stressor whenever they're looking at, I was a champion and doing so great, and now I have half of that milk supply. So the first question I would ask is, number one, how did she notice the change? We know she saw it in the output, but was there anything different that happened prior to the 3 and 4 days? And I want to know what changes took place with the breast. Was she noticing any redness, any soreness that she felt? That would be kind of my first problem solving question. But what about you guys? What would you ask that mama?
Yeah. What's the longest that she goes at night without milk removal?
Okay.
Yeah, those are great. I'll tell you what, yeah, go ahead.
No.
Older babies they're tough. They are tough. They present some different challenges because there's so many different things it's running through my head right now. One thing I may ask her is, has she started her period, or is that something new? Anything new that has happened in her life recently? Period being one of them.
Absolutely. Okay, let's pop the first poll question. And let's see what came to mind for you guys.
Has everybody seen the poll? Oh, there we go. We're getting our votes. We have,
Oh, yay.
okay. Lots of votes are pouring in now. Okay. Let's leave it open for just a few more minutes, Micah, and then you can share the results. Okay, I think we've gotten all the votes in.
Oh, look, yeah. Asking questions about that nursing pattern and behavior of that baby and what everything has looked like. Perfect. I think so too. And then the other thing that comes to mind, so let's say, I'm just going to tell you what she said to me. There was no change in anything with the nursing pattern, no redness, no soreness, anything like that going on. The longest that the baby would go overnight was about 3.5 hours. Okay. No starting of the period. And so what would be another question that you would ask her past that point? So everything looks good. Oh, someone
What?
said baby food.
Mhm.
What I was thinking. I was just about to say, what has baby been introduced to solids, and what does that look like in her day?
Yeah. Yeah.
Medication.
Actually, they had started solids because they're with Women, Infant, Children program, and that came on their food package. And so they had started the infant on solids. She had not started any medications because if you think about the time of year, it's cold and flu season. And so inadvertently, sometimes moms just don't think about that. So she'd not started on any antihistamine or anything, and there'd been no sickness in the home. Okay. So now what? How do we pivot in thinking about, yeah, there was some solid introduction that took place, but baby was still nursing the same amount of times in a given day. that was that normal pattern because she tracked it on her phone. They're so good. They track everything now. And so that hadn't looked any different. So now what could we do to ask additional questions?
Did she change anything with the pump? Or what settings is she using? Are the flange, I mean, I would, it would be strange for flange sizing to be suddenly a problem now,
Mm-hmm.
but did her
Maybe
pump
if
wear out, or did she turn the suction down because it's uncomfortable? What pump is she using, and is it working?
yeah, and maybe if she needs to replace her pump parts, you know, if she is, I don't know how often she pumps other than when she's at work.
Mm-hmm. Great, great. Because the actuality of everything was, if we look at a hands-free breast pump, and I know that you know this, sometimes that suction isn't great, depending on how the mom has it placed in there and what else she's doing while she's got that wearable pump on. But some of them have duck bills, and if those little duck bills, and we know that if it gets a little gap in there, that suction is not good. And then sometimes they think that it's easier if they set the settings full throttle. If they have it as fast and as high as that level will go, that it's going to remove more milk. But the reality of that, we know that, is a lesser amount. Okay, let's pop up poll question number 2. Because I can't remember what it is. All right, so when we're talking to that mama, what do you feel like is her biggest concern?
Okay, people are faster voting now.
Yay.
So yeah, we've got about half the votes are in. Oh boy, this is going to be tough. It's tied. If you haven't voted, you're going to want to vote to break the tie. Okay. Oh man. Okay. Which is like all things, right? There are ties. There are several different ways you can go with this, right? Okay. Do you want to share the results now, Micah, please? Thanks.
Her concern, look at you guys, you did very good because they're both so very close. She was most upset about the fact that she thought that supply was going to continue to go down and she was going to have to do formula supplementation. And the backstory on that, on the case is she was not successful with her older child with breastfeeding, and she had to give formula. So it was very important for her that supply was not going down because she didn't want to have to supplement with it. Yeah, on that end. Okay, any other questions before we go to the third question on our poll, or any other input that y'all want to give on this case? Anything else that you would ask this mama? Definitely problem solving that pump and how she was setting it. Ooh, pumping environment. Oh, that was good, Sarah.
Mm-hmm.
It is.
Yeah, another thing to explore would be her mental health. Does she suffer from anxiety, and is anxiety in the workplace interfering with let down?
Yeah, that her work environment is very stressful. Even though it is only that short period of time, Kathy, it was. And that pumping environment, because she's a CNA, she was running all over the floors, and they were short-staffed. And she also had that wearable pump on, that the part didn't fit. So there were all kinds of factors that came into play. Happy news on the backside of it, she did replace both the tubing and the duck bills, and supply came back up in just a few short days, and mom was doing great, and we kept doing weight checks on that baby, just to make sure everything was great and wonderful with supply, because she wanted that to have that security and knowing that. Okay, Question number 3, and then Stephanie will be quiet. Oh, Kate, look at that. The possibility of being pregnant again. That was good. So how would you assist this mama? And just from the Stephanie Henry side of things, I like to always have my eyes on them. I think that it's great just to visit with them over the phone, if it's a simple thing, but I want to see the baby and I want to see mama because I want to have that heart connection. What about you guys, Kathy, Stephanie?
Sure, absolutely, as long as they're not too far away. Yeah, to physically be able to get to you, but sure, in person is always better, especially when dealing with a stressful, angst-filled situation like this.
Yeah, absolutely.
I completely agree.
Oh, look at that.
I
Y'all
want
are
to see her too.
Like, you all agree. This is amazing. Woohoo! Follow up in person. But I hear what you're saying, Kathy, that, you know, in these rural areas especially, or even in large cities, it's not always practical. Hey, I'm going to throw a curveball at you because you all are. Before we move on to the next case, could you address some of there were 2 comments in there that I think are worthy of diving into just a little bit more. And one is stress. The idea that stress decreases the milk supply. Would one of you or a couple of you be able to address the connection, the correlation between those 2 things? Is stress in and of itself the reason, or is it more likely they're just not breastfeeding as often? And then the second one is rapid weight loss. Because we have moms on these medications, we have moms exercising. Would either one of those be an impact on low milk supply?
You know, most moms are stressed in our world. So we don't have good data that pure stress levels impact milk production, but we do have evidence that epinephrine counteracts the effects of oxytocin. So when I see it clinically is when someone is acutely stressed, and then they don't let down well in that moment of acute stress. So if that happens all the time, it can eventually drive production down by lack of removal. And then the other one was, rapid weight loss. We don't have good evidence for that either. But the rule of thumb is if they're not losing more than, what is it, a pound a month, something like that, or a week. I can't remember now. Slow and steady wins the race. It's not a great idea to stress your body out by limiting substrate to make your milk with in general, but we don't have good data about it that I'm aware of.
Thanks for taking it. Stephanie, Henry, or Kaufman, do you have anything you want to add to those before we move on to the next case?
I don't. That was great. I took notes on that.
There's a mention of
I would
moms
say
get upset.
that some of the moms.
Yeah, Stephanie?
I was just going to say, I know that some moms, kind of that weight loss thing, I feel like about that 6-month time is when they're asking about that, and really just helping to educate them that you do need those extra calories, and breastfeeding is, you know, if you have somebody coming to you about that. And of course, you know, a good nutrition and exercise is great for everybody, but just keeping in mind that you do need those extra calories.
Good point.
Someone had mentioned in the chat, Sarah said that she has an increasing number of moms reporting that they can't feel their letdown, thus causing stress about the milk that they're providing. Kind of seems like some are stuck in a cycle, a stress cycle.
Yeah. That's just really not a thing. I mean, some people never feel their letdowns, I think, and we don't have research on this either, but in general, the more full you are, the more likely you are to feel your letdown. So yes, people with low production tend not to feel it, but not feeling your letdown doesn't mean you're not letting down. So just reassurance that not everybody feels it, and that's okay. So stop trying to feel it.
Good advice. All right, Kathy, this is your case study that
Yeah.
you gave. Walk us through this one.
All right, Emily's a 36-year-old who delivered her first baby after being induced for hypertension at 37 weeks of pregnancy. She did have gestational diabetes, but was well controlled with diet and did not need medication or insulin. But her baby did end up going to the ICU for low blood sugars that could not be controlled at 23 hours of age. She started pumping with a hospital-grade pump at 12 hours when they provided her with one, because the baby was too sleepy to latch from the hypoglycemia, and she did not get anything but drops for the next 24 hours when she finally obtained 5 mLs per side. She and her baby were discharged at the end of 3 days when he bounced back, and she comes to see you at 5 days, 2 days later, because the baby's now refusing to latch. She's been pumping, I didn't say, but routinely every 2 to 3 hours, at least 8 times in 24 hours, and only getting a maximum of 15 cc's total. So there are a lot of details missing here, but one of the things I wanted to explore was, what else do you want to know to help this mom?
I would like to know what type of delivery she had. Did she have a C-section? Or was it a vaginal delivery?
It's vaginal. It was a vaginal delivery. Yep.
Okay.
Yep. No, the baby was fine, and she was able to do skin to skin immediately.
Okay.
I would want to know, was she doing hand expression with that? Because so many times I just find that they're honestly not doing that even in the hospital setting. That's one thing that we've tried to come in, and we've got breast models and everything, and teach that in our prenatal trimester classes, because many times they haven't even heard of it and not know that. So I would want to make sure that we were doing that, and we, if we were with her, that we were teaching her that, how to do that, because that's the best thing.
She had prenatal education and was concerned about her gestational diabetes and did try hand expression, never got a drop.
Never got a drop. Okay.
I just saw in the chat here, which was something I was thinking about as well. Excellent. Susie, I think, said amount of bleeding, possible retained placental fragments. Absolutely. I also think with the gestational, she had gestational diabetes and hypertension as well. What kind of medications is she on right now? Is that well controlled? I mean, I'm assuming they're following closely, but she's at home, so those would be some questions.
Yep, she got sent home with nifedipine, which in and of itself doesn't put you at risk for low production, but yes, she's controlled on her nifedipine. She's just watching her diet with the diabetes, and she's on no other. Oh, she is on an antidepressant, Tritilex, one that raises norepinephrine and serotonin, and she has been through the entire pregnancy.
Is she engorged? Like, is she, when she's pumping, feel like she get?
Yes. So in my mind, the biggest question here, is this delayed secretory activation, or is this primary low milk production for some reason? And you can't really always tell at 5 days, right? But if she is engorged, then she is having secretory activation and the milk is not being removed. You got to figure that out and start taking it out, or it will go away. Or even asking, were you really engorged 2 days ago or yesterday, if she isn't today? So that is huge. You have to identify, is there a delay in secretory activation, or has that happened and you're not removing milk? Yes. So no, she has felt no. She's maybe feeling a little fuller today, but no discomfort, no firmness, no.
So we would expect that we would be feeling some engorged, some fullness by now.
Yes. So yeah, that is the biggest thing I wanted to get to here, is delay in secretory activation, and that importance. Even if you see her 3 weeks later, asking, did you feel
Mhm.
really, really uncomfortably full? And if the answer is yes, then you can blame a lack of removal that happened 3 weeks ago that you can't do anything about now. But it
Mhm.
changes what you're looking at and what you're looking for if she never felt anything. Another big
Absolutely.
question would be, did you have breast changes during pregnancy? And yes, she had had increase in breast size during pregnancy.
Mhm.
So the big thing I wanted to say, like I said, was to share the biggest risk factors for a delay. And in the research, a delay of secretory activation is considered anything beyond 72 hours. The biggest one is primiparity, or having it be your first baby is a big, huge risk. And this was her first baby, to have it take longer than 72 hours. But other great big ones are maternal age. Some studies look at say over 30, and I'm going to put this in the chat. I can do it right now. I'm going to type it and put it, or cut and paste it into the chat. But there was a big recent review of all the studies that have been done looking at delay in secretory activation. And first baby is the biggest, most evidence-based reason. Maternal age is up there, over 30 even, or over 35 in other studies has been correlated with a delay. Elevated BMI, anywhere between elevated over 24 to even 24, which isn't bad, to 30, in 14 different studies has been shown to be equated with delay in secretory activation. Cesarean section birth, we've known a long time. Excessive weight gain during pregnancy in and of itself. Gestational diabetes in and of itself. Anxiety or depression during the pregnancy. We have 8 studies about that. Maternal stress. So somebody mentioned stress earlier, and I had to laugh because many of the situations, like maternal infant separation, baby has to go to the NICU and they're separated, has definitely been associated with delay in secretory activation. And is that stress that my baby's been taken from me and they're ill, and the cortisol levels interfere with prolactin, the effect of prolactin on the breast. So the big point to make is there's a lot of reasons, and some of them are really intertwined, and we can't always know for sure which reason is the culprit, and a lot of them we can't do a lot about. But you need to know what they are so you can reassure the parent, oh my gosh, you're over 35, you're have a gestational diabetes, and you had hypertension during the pregnancy. All of these are potential risk factors for a delay. I'm really hopeful you're going to see your milk increase. It's already increased from 5 to 15, and I'm hoping it's going to keep going over the next few days. I need to watch you closely, and your baby needs to eat something, and all of that. So sorry, that was a big
good.
long, that was a big long blah blah blah.
That
So I don't want
was
to go over time. Okay, and we didn't get to ask our poll questions too.
well, I was going to say, you have the questions if you wanted to post to the group for the chat. The question, you got to the possible reasons for low milk production, but your other question is what questions would be helpful?
Yeah. What other questions would be helpful to ask to try and figure this out?
Looks like Sarah's on it. She's already.
Yeah. What can mom do to help her situation? Just work on latch? Well, I would check her pump and pump flanges and show her how to gently compress her breast while she's pumping, and explain the importance of getting every drop out as we hopefully watch her production go up, and teach her about volumes. How much milk does that baby need to eat? I already gave away one of mine about have your breasts, somebody else already asked, have your breasts felt full, which I think is a huge question. And then another one is, did you feel changes during pregnancy? Is latching or pumping painful? How much is the baby at the breast? We haven't really talked about, which I gave all those away.
With the gestational diabetes, and like you said, everything being so intertwined, would you go down that path of her history if she has PCOS, or would that be another appropriate question?
Yes, absolutely. Are you able to hear baby swallowing while nursing? That's a good question. And you would want to do a feeding with her and weigh him before and after, and see, maybe she's only able to pump a little bit, but he's taking out a lot. That's possible.
Yeah, and I guess my heart is going to really counseling her on, sometimes I feel like their view on giving birth was one thing and the actuality of it was something else. And I
Yeah.
look at how are her feelings? Sometimes they grieve the part of that birth did not go the way they had planned it to go. And so I always like us to look at how is that mom feeling and the stress of all this. Milk supply and everything aside, how is mom feeling? So that's kind of where my heart went as I was reading this too, just thinking about how I would feel as a new mom. So I think sometimes we're so focused on the baby that sometimes we're not looking at how is that mom really doing? Do we need to really have some extra life preservers that we're throwing out there to her because she feels like she's just treading water? I don't know.
And
That was my
her
thought too.
baby's now refusing the breast, right? Which feels terrible. You know, you
Yeah.
offer it and you want to nurture your baby and they scream at you and pull away. So
Mhm.
let's ask the third poll question
Okay.
with our last 2 minutes. What suggestions do you have to help this baby be willing to latch to the breast?
I
Why?
like a baby moon. That's what I call it, a baby moon, where they're basically just skin to skin. And we've got other people in the home that rally around to be that anchor of support, whether that's husband, best friend, both the, mother-in-law and mom that are there that are cooking meals, doing laundry, and her job is just to solely love that baby and connect, especially in a situation like this. That's the Stephanie version of it.
Beautiful. Any other ideas? Getting
That's
this
this
baby.
Stephanie's version also.
High five, sis.
Yeah, can't express till a little milk's coming out and then try and latch. Yeah. Assuming, why is the baby refusing to latch? Why do you think he's not latching? Why do we think? Babies are smart. Why is he mad at those breasts? Because he's not getting enough. So they give up on it and they are getting fed a different way, usually a bottle, and say, I like that better. So
One thing I like to do sometimes, how is she supplementing with something as well?
yeah.
Okay.
Yes.
I love to have them give like maybe half of the supplement first. And
Mhm.
when baby's nice and calm, then put baby to breast, and
Yeah.
you may get a less frustrated, more effective feed.
Yes, that's a great idea. Yes, she currently is purchasing donor milk, hoping her milk will come in. Um, so yeah, my big suggestions beyond that would be a tube-it breast is an awesome way to supplement at the breast, help the baby fall back in love with it because it's nice to be there and their tummy gets full. And it feels so nice for the mom to have the baby back at the breast. And if that's too difficult or they can't manage that at home, another way besides trying part of the bottle, which is probably an easier way to do it, but another idea is to not only paste the bottle with it parallel to the floor, but dip it down. Don't let the baby have milk for 30 seconds and then dip it up
Yeah.
like it has a letdown too. So they're more willing to give the breast a few minutes to see if it's going to give them milk. Those would be my biggest ones. And then, of course, getting her production up to where he gets plenty is the biggest way to have him be happy there. Yeah.
We all took a deep breath on that one. We all went, yeah, because we're cheerleading for that mama. I saw us all. All three of us went.
The
Right.
happy ending. Happy
Yes.
ending.
Happy ending.
Her production eventually did come up, and that is actually my daughter's story that had her baby 3 months ago. Yeah.
Oh,
She's allowed me to share with photos of their journey. And yeah, it took 6 weeks for her to have enough milk, but it slowly came up with a lot of work.
wow.
So don't give
Very,
up.
very, very, very fortunate to have you as a mom.
Yes.
But I would
Yes.
like to think that with any skilled lactation, we would have the same results. And I think it's really that using all of the tools that we have available to us, that we would have similar results with that. But I think the story also illustrates that we don't give up at day 5 or at 2 weeks. And this was 6 weeks before it was like a solid breastfeeding experience. So yeah, what a great reminder. Okay, Are you all ready for the next one? This is a Stephanie Kaufman case. Thank you, Kathy. Amy, are you able to show the next slide, please? Oh, hopefully she's still there. Micah, can you drop it in the chat if you have that?
Sorry, I'm giving my my info from my paper. There you go.
That's all right.
Perfect. It all fit. Yay.
Okay, just a second. I'm going to share my slides.
And I just dropped it in the chat also.
Thanks. All right, we're going to go to case number 3. Oh, sorry. 1, 2, 3.
We could
All
talk
right,
about
Stephanie Kaufman.
All right. Okay, we have a breastfeeding mom that's been working with you since the birth of her baby, and baby has gained adequately, returning to birth weight at day 10, celebration. Baby is now 3 weeks old and has increased her feedings, and mom states, I feel like I'm feeding her all of the time, like she just cannot get full. Mom wants to schedule an appointment to see if baby is losing weight and make a plan for increasing her milk supply, as she is planning to return to work in just a few weeks. So, first thoughts. Would you like me to do the poll question? I'm so sorry, I don't remember what you girls did.
Oh, I think we chatted first. Yeah, so I'm wondering what is the feeding pattern like?
Oh, that was mine. That's
Sorry.
Say that again. I didn't get that.
How often is the baby nursing?
Okay.
Day and night? And for how long? And both sides are 1.
Yeah. Yeah. And what is a lot? What does all the time mean to her?
Right.
That's very important to figure out.
Yeah.
Yes, the mom's perception of it, because I think there's so many times they don't understand what is truly normal. You know, we cover that in trimester classes and we talk about it, but I think until you're in the throes of it, they don't
Yeah.
really realize how long that it takes to nurse, and then baby sleeps for a minute and she's barely done anything and it's time to do it all over again. And so, yeah, perception.
Yep. And add in extreme exhaustion from those first 2 weeks, which, let's face it, they suck sometimes, no pun intended. It's just trying to, and you're recovering from birth. There's just a lot going on there.
Yeah. And hormones and emotions and lack of sleep and all of the above. Yeah. Yeah.
Right.
You ready for the first poll question then?
Yep.
Let's see what they think. All right, so has everybody seen this one? The 3-week-old baby suddenly wants to nurse more. What's most likely the explanation? Okay, everybody's on it, and I can tell you there's one overwhelming winner on this one.
Yes, there is. Everyone seems to agree for the most part on this one. That was quick. Okay, I'm going to share the results.
Oh, yeah. Look at us.
Yeah, that's excellent. A lot of times, like when I see moms in the home in those early weeks, and I was just talking to my husband about this last night, how many times I am saying this, here's some anticipation of what you may see here before I see you again, to kind of help them understand, of course, making sure they are aware what is indicative of growth and good feedings and poop and all that good stuff. So
yeah, and really equipping them, because so many times we know what's coming, but they don't know. And so with that we talk freezer meals and everything else to make sure that they are fully prepared for how that road is not straight and narrow and it twists and turns. And so, yeah, I love that, Stephanie.
Okay, here I'm coming with another curveball at y'all. How do you know it's a growth spurt? I
Yeah.
mean, I know that when I first learned, in lactation, like we would say 3 weeks and 6 weeks, and we had like these markers of time. But then I began to question that. And I think mostly I talked to you, Kathy, one time to say, well, there really isn't evidence to support those. We kind of see patterns, but how do we know this is a growth spurt other
Yeah,
than the age?
I would push that back a little bit on that. I don't really believe in growth spurts. I believe that babies alter their nursing patterns based on supply and demand, and so maybe the supply goes down a titch and they nurse more often and it comes back up and then they back off.
Mhm.
So I would not feel comfortable just saying, it's your 3-week growth spurt. I would need to weigh the baby naked and do a feeding and make sure that that all adds up, because it could be something else.
Great.
I
And
also admit
okay.
that I live in a world where everyone is falling off a cliff with breastfeeding. So
Sure.
I feel pressured to think of the worst case scenario in every moment.
Yeah. Yeah. And I think to education piece on pattern of the baby. Sometimes it's snacks and meals. Sometimes it is snack, 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 meal. And so that could be also what's kind of going on. And so it's that education piece on that
Yeah.
part and getting into what's going on with the mama. And I really do think a lot of it is perception. It can be the same with their perception of low milk supply when it really is not a low milk supply. On that end. So deep diving into the mama a little more.
Yeah, I would probably ask her too, do you feel like during the day, is there a certain time that is more, you feel like you're feeding your baby more? Because we know when those prolactin levels rise and when you're most likely to get some more fuller feeds and when they're going to cluster feed a little bit, and just all of that education piece as well.
And did you see in the chat the suggestion about feeding cues? How does the mom know that the baby's still hungry?
Mhm.
And the
Yeah,
idea of the
that's
baby's
excellent.
posture. Yeah.
Good job, Susie.
I think we have another poll question with this. Micah, do you have the second one?
I do. The next question is, what is the best way to determine if this baby is getting enough milk? Most are using the same answer. Everyone's in the swing of it now.
Oh my gosh. Look at everybody. That's great.
Yeah, I don't care about the diaper output, but the weight for sure. The naked weight is the bottom line.
Yep.
Mhm.
Absolutely. That tells the story. It absolutely does. So
Yeah.
if you're questioning anything, I would absolutely put eyes on this baby and weights for sure. You guys are awesome.
Okay,
Yeah.
question from the crowd, mostly from my head. The question is, let's talk about the poopy diapers. Because like you said, Kathy, you really like the weight is the benchmark, but many people on the call are doing help remotely. Somebody's called in, and they're traveling great distances, so we can't get a weight. Are poopy diapers still a good indication, or do you just not even ask about them? I mean, I was trained that poopy diapers, that you can't have those if they're not feeding. Can you just explore that a little bit more?
Me personally, it's just that I just came in from seeing a baby that is, how old was he? 2 months old and has lost weight since his last checkup, and he's pooping 6 times a day. It just isn't meaningful. So, and this kid, I think, has a dairy sensitivity, and that's why he's pooping 6 times a day. Yes, in general, if you're not eating, you don't poop, but it is not a guarantee.
Mhm.
So,
I
and yeah.
I have seen that also. And Brenda, I completely agree that is, we are ingrained in that it should be very reassuring that you have these bright yellow poops and lots of pee. And I've had babies coming back in over and over and over. And I remember getting frustrated. Why is this baby not gaining weight? And like, I wasn't getting the whole picture. So Kathy, that thank you so much just for kind of
Yeah.
Giving us more information on that, because that I have definitely seen that before.
Yeah, it's most helpful in the first 2, 3, 4 days. It's roughly indicative, but still, it's not. It doesn't trump the naked weight. The naked weight is the only thing that tells you what's really happening.
Okay.
Mhm.
Stephanie, Henry, is there anything more you want to add to that?
No, I agree with all of that. Yeah, and I think our mindset has changed. Just, the further down the line, I look at, what we looked at 15 years ago and
Mhm.
past 2 years. Yeah,
Yeah.
on that.
And I've learned a lot. I had the pleasure of traveling around with Kathy Leeper around the state, and so we had a lot of car talk time. And I vividly remember one time, Kathy, you told me about this holistic gestalt method of approach to breastfeeding, and that oftentimes yes, you did say that. I
Okay.
think, yeah, it was brilliant. The fact that sometimes we get so fixated on one data point, one thing like poopy diapers, and then we miss the big picture. And so I think I'm trying to take that bigger picture and look at all the different indicators. And so if one is kind of an liar like the poopy diaper, then we can look at something else. And so I think we have to look at more than just one indicator of how breastfeeding is going.
Mm.
Sure.
That was my takeaway from our car talk. Correct me if I'm wrong, though.
You had fun.
We did. Was there another poll question with this one, Micah, or do we want to
Yes.
move? Okay, and then we'll move on to the last case.
The last question for this case is, what advice would you give this mom?
And while we are waiting for the votes to come in, and there is a question in the chat about emPOWER, which I think is an app. I don't know if anybody wants to address that while we wait for the votes.
Yeah, she's asking that because it's in my list of things I put in the chat from that paper that is a possible reason this woman in our case wasn't making milk. So Abilify is a dopamine agonist antagonist. It's used as a mood stabilizer a lot now with antidepressants, meaning that in some people it makes dopamine go up, and other people it makes dopamine go down. If it makes dopamine go up in you, that forces prolactin down. So there have been a lot of case reports, and I've seen a lot of women who have taken it all during the pregnancy, and then they don't have their milk come in because their prolactin is in the toilet. And I've also seen people who get it added weeks, months postpartum, and they see a sudden drop in production. So it should be on your radar as a medication that can decrease production at any time and tank your potential to make milk during pregnancy. Yeah.
You're muted, Brenda.
Thanks. Thanks, Kathy. I'm like never muted, but thanks for that. And we're seeing the results for this question.
Yeah, and I just say, as long as baby's naked weight is good, then you can say that.
Nice. Okay. So I'm looking at our time. We have 12 minutes left, and I don't know if that's enough time to go through another case, although we certainly can. We have actually 2 more teed up, but I'm going to turn to the audience, if I could see you all in the room, and see what questions we have. This is your chance to ask 3 experts questions about low milk supply that maybe we haven't addressed, but that have come up for you. Like, is this true? Or I'm seeing this. Maybe we can turn this last 10 minutes into a bit of a Q&A rather than another case study. I'm seeing panelists nodding, so you're okay with this pivot. Thanks.
Sure.
All right. You can unmute to ask your questions or put them in the chat.
I have a question going back to the preeclampsia case. I saw several moms in a row who were struggling with breastfeeding and they also had been treated with magnesium in the hospital. I was just curious if there's any correlation specifically to that treatment, or was it just maybe the stressful birth and everything going on with mom more likely causing that?
Yeah, I'd say likely all the things. Mag sulfate, I'm trying to remember, I think in my summary systematic review paper, has been implicated in the past, but it's just a common treatment for preeclampsia and hypertension that is a risk factor by itself. So I don't think that that has been teased out as an independent risk factor. It's the hypertension that you're using it to treat. Does that make sense?
Interesting. Stephanie, I know with your experience, Stephanie Kaufman, are you seeing any correlation like that in the hospital?
I wouldn't say so. We've had some interesting, like different providers that have come in and have said that if mom is on mag, that don't breastfeed your baby, which has been interesting to say the least. And I get a call about that a lot. So
wow.
Okay.
No, also somebody said that a provider told a mom that the Abilify did not affect their production. So I'm just going to share in the chat the link to the LactMed entry about that you can share that with them, that they're not right.
I think we could have an entire session on how to gently correct other healthcare providers, right? With the misinformation. That's a lot of our job, I think, is to either empower the parents to carry the information back, or we carry the information. And that can be challenging.
Yeah.
Definitely.
There's a question about figuring out why some moms can't make milk, and we're learning more all the time. You know, I started doing this 24 years ago. We didn't know anything, and now we know a little bit. We've learned that there can be prolactin hormone genetic problems in the formation of the hormone, so it doesn't work right. There can be genetically inherited problems with the receptor, so that the prolactin doesn't fit in it very well. These are rare, but they might explain that rare woman who has no reason to make like no milk. So yes, we can check a prolactin level, but it doesn't always mean it's functioning prolactin, and we don't have the wherewithal to look at that at a granular level at this point, which is really unsatisfying. Yes, getting a prolactin level can definitely help most of the time. Is the question. Does the prolactin levels help? Yes, if they're really low, it can help explain what's going on. You can't always fix it though.
Okay, and then Sarah has a question about if there is fragmented placenta, what do you do next? I'm wondering if one of the Stephanies, like you probably see that, where do you refer that parent to?
absolutely to their OB.
OB.
Oh.
Yeah, to one of our midwives or the OB, whoever delivered. We have 4 of them, so yeah.
Okay.
And is that just like an internal office test, or because I don't want to like panic a mom, be like, you might have this, obviously say it
I
better.
would be asking her, what if she's having some cramping, anything like that as well. What is her bleeding like? I mean, sometimes they're not bleeding at all, and then all of a sudden they do. So I don't know. It's kind of
on their own, or is that something that has to be fixed?
Dr. Leeper?
It depends. It depends. Sometimes they spontaneously pass it and it's all better, but it should still be checked out by their OB. Yeah, and it can be difficult if they're not bleeding or cramping. It can be difficult to get an OB to want to pay attention to it. There's 2 ways to look for it. You can do an ultrasound, and in the first couple of weeks postpartum, 3 weeks, it's hard, I've been told, to tell the difference between schmutz in the uterus and retained placental fragments. So I've turned to getting blood levels of HCG.
Mm,
Can't tell anything by one blood level of HCG, which is a pregnancy test hormone, unless it's super high. But if it's kind of high and you get another one in a week and it's still that high, then you can say, hey, OB, this isn't falling, and you should go look in there and get it out. If it is falling, it means it's just naturally falling from when the placenta was taken out.
Interesting.
Oh,
So
that was good.
yeah, so requesting a blood test. The parent could do that and say, hey, if you're not willing to, or don't want to do this, would you be willing to do this? Yeah, nice. Okay, and then we have a question about tongue and lip ties. And yes, you are right, Miss Sarah. That is a
The whole
whole
hour.
or more a day. It's just, yes.
Well, I know we
But-
have a pediatric dentist here who has the laser, and everyone who has one gets fixed. And so I know there's been a lot of research that it's not always necessary. So I always just tell parents, go have the consultation and then make a decision based on what you feel is right. But they tend to look at me and say, but what do we do? And I'm like, well, I can't make that decision for you, but I feel like I want to provide more information to them about the benefits or the risks. And I don't
Well,
always.
we can tie that into this discussion in that sometimes a tongue tie inhibits milk removal, which then can make milk supply go down. So actually that's something I thought about the 3-week-old who was doing fine and now is eating more often. That can be a tongue tie where they live on mom's letdown and do great for a couple, 3 weeks. And then they start ramping up how often they want to eat because they aren't able to remove milk well. So if the baby can't latch without pain with optimal positioning and help from you, or they're not getting milk out well, and they have a visible, findable tongue tie that appears to be limiting function, then that's an appropriate reason to have it taken care of.
Well said in 1 minute. An entire, yes. So it's both milk transfer. This is what I'm hearing. It's both assessing milk transfer, pain-free, and function of the tongue, what it looks like. So both what it looks like and how well is the baby able to use it. And again, that kind of holistic approach to the evaluation. And I think that the Academy of Breastfeeding Medicine has a new statement out, which addresses some of this conversation, including the lip tie, laser versus scissors. And so we can definitely put that in the summary documents, the ABM protocol. And Kathy, if you want to find that while I give the wrap up comments, then Sarah and others can grab that from the chat. But this is an evolving conversation, very similar to, the growth spurts. What we thought 15 years ago is no longer what we think today. And which is good, right? We continue to learn and change our practice. So thank you. Okay, I want to extend huge thank yous to Stephanie, and Kathy. This has been amazing. I hope you've read the chat. While I give the wrap-up comments, please scroll through the chat. Everybody is extremely grateful, as am I, for you taking your time to do this. And we're very excited for the next one, which is going to be in, I think it's May or April. I think it's May. Sorry. We should have had a slide on that and going over the topics. Apologies. You just are going to have to read our newsletter so that you can get the next one. It's either in April or May. And no, let's see. It is on May 9th. There we go. May 9th is the next one. Okay. And before we leave for the day, I did want to give a plug for our new Breastfeeding 301 skills days. So if you want to know about like how to use cups and spoons and, supplemental nursing systems, flange fit, pump assessments, all of that, we're going to have stations set up at these. No slides, y'all. These are no slides. We are going to be up and moving around and going through different stations. So this is a great place to continue refining your skills. And the next slide. Okay, breaking news, you all. The KBC board met at their last meeting and have decided to change up our mini grants that we have been giving now for several years to local coalitions. You probably remember in March of every year, you would receive an application so that you can apply for a grant for your local coalition to do a project. Well, this year we decided, the board decided actually, that they are going to do stipends to all local breastfeeding coalitions. You simply have to literally raise your online hand and say, we're a coalition, and then we're going to divide $10,000 amongst all of our local coalitions. So you just simply have to fill out a form, let us know that your coalition is alive and well, and then we'll, and you have to identify a fiscal agent. And then we will be dispersing those funds. The funds will be at least $500. We've guaranteed that floor, and could be more depending on how many coalitions identify that they're out there. So be looking for more information in March. We hope to make this easier for coalitions to have the resources they need to do the great work that you all are doing. So, all right, and that's it. There we go. And if any of this has been inspiring to you, we encourage you to make a donation to the KBC, and we are grateful for our funders as well, which are listed there as well. So thank you so much, and thanks again, Kathy, Stephanie, and Stephanie. We will see you on May 9th. All right.
Okay.
Thank
Great.
you.
Thank
Thank
you.
you.
Bye-bye.
Bye.